Good morning, everyone. Happy Wednesday to you. And thank you again for joining us in the conversation about transforming mental health through social work. Where today is just a day about exploring what it is that means. All of this, again, leading to a conference or a panel that we're going to be hosting in March. That's going to be all about the transformation of mental health through social work. And part of that exploration has been meetings that we've been having with different social workers around the United States. Our Friday social work power certificate course, where you could come to one session, you could come to all of the sessions. It's really an opportunity to connect with other like-minded social workers and people who are in the place of wanting to explore what it means to transform mental health and what it means to look at this from the lens of being a social worker, where we are in all the different domains and all the different areas of service provision. And so there's a really unique opportunity and a unique view that we have in the discussion and in the design or the conceptualization of what a transformed mental health system looks like. And so as we continue those conversations, some of the things that have been coming up are, what would that look like if we really took a moment to think about it from the context of starting from nothing, starting from scratch again, and what the mental health system would look like. Where is it being done where it might be working a little bit differently or a little bit better or a little bit more effectively than it might be happening here with us in the United States? Or are there communities that really know how to ensure that all the members of their community are well taken care of? What's currently working? And simultaneously, what can be created if we thought about starting this whole process over from zero? What would be the ideal system? And it being one of these things that can be a little bit of a difficult process to be in because of what we're so used to already seeing and what we're so used to having exist in the world already. And the process of really being able to take a step back from that and look from a new perspective is really it's a wonderful place to be in exploration. So that's sort of, and in that, in all of those dynamics and thinking about, the transformation of mental health and how to do it without any bias based on what it is that we're already doing, then also simultaneously looking at who it is that we are as social workers and what our evolution looks like in the same kind of domain, in terms of if we were to do this from the beginning again, from the real heart of what social work was when it first started, what would we do similarly? What would we do differently? How would we want the profession to evolve? And perhaps it's exactly where it is that we want it to be. But all of those sort of being these simultaneous conversations that we're having about the transformation of mental health, because it certainly can't be done from the same mindset that we have been currently operating, which also means that it can't be done from the same mindset that we have had as social workers in how it is that services are provided and who we are in the work that we're doing. So some of the conversation that we're going to be having coming up is also going to be about what it means to be in a place of empowerment when it comes to the work that we do with other people, how it is that we can help facilitate an experience of empowerment for them or with them, so that it's something that is recognized within themselves, that then they can take some action around. And some of the conversations that we've been having lately as well has prompted, a thought process, internally, I think, because we've received some communications from people about how there are so many times in social work practice that it's felt like an isolated endeavor, where it's you and your client, and that's it. That's the whole process. And certainly in integrated care, how those things have changed, and in networking and collaboration, there's been far more of an embracing of what it might look like to collaborate, but really it being from not the lens of one collaborating with one, but of really thinking about collaboration in terms of a universal experience where there's nothing that needs to be done alone. And when you are with like-minded people, there is this experience of empowerment because you don't have to do things alone. And I think I certainly have had those experiences where my belief systems, how I was raised, the things that I did, in growing up and in caring for the people in my life, it often felt like something that I had to do alone. Or something I felt responsible for doing alone. So I think there's something to be said about, in that space of being someone who's empowered, of also thinking about things in the context of what it also means to be a helping professional, a social worker who can really step out of the role of I can do it myself and operating from an isolated one-on-one kind of circumstance to being an all with all kind of circumstance. So, collaboration in its truest form. So that's all I've got for today. I look forward to hearing what your comments are. Please put them in the chat box below, and have a wonderful day. And we look forward to seeing you next week as we continue these conversations.